Pharmacy land. It's time. It's that. This week in pharmacy. It's March 20th. I'm your host, Podfather. Busy week. Hey, pretty excited with you. We have building this show and an intro, and that new intro is built by animation team, and we're going to have the founder of Future TWIRx, and guess what? Boom. So got in pharmacy, and I want to get the show, so let's go. Welcome to TWIRx 26, and like I said, tracking some major developments. We're going to get into TWIRx, and there's things that I really want you to look up. I don't want you to listen here, but go look them up. We're going to have links. I also want to give Cole McClure, the CEO of marketing. We have a special plan for, and there's going to be a lot more press involved and a lot more build out of our organizations coming together to really cover this, and that is the Pharmacy 2026. This is going to be in Vegas. It's an amazing show, a gathering of specialty pharma minds. If you want to be part of the, please fill in on that form and schedule in. The team does building that conference, the food atmosphere, the entertainment, the not a ton of CE, and that's not really what it's for. But number one, the networking are the best in the business for pharmacy. Excited to be back, going back. Hey, I authored an opinion in pharmacy. Excuse me. Vertical integration in pharmacy software to pharmacy stability. For anyone that operates a pharmacy, a PIC, pharmacy manager, a pharmacy owner, specialty, I don't care what sector it is. And I want you to understand we're doing to ourselves again. And when I say it's the first time we did it to ourselves, industry let the PBMs get away with, it's still going to be to straighten some things out. Was about a similar grip in the realm of pharmacy stock becoming Leviathan giants, different sectors of the pharmaceutical trade, pharmacy sector of pharmacy, and is really rising to, and it should concern everyone. Not the world is falling, being hyperboreal about it. I'm being cognizant of it. Let you know, you don't ever want. We've learned it with the. Don't want, 3 organization so large that they begin changing, pull away the control, the operator, the pharmacy manager, the pharmacy that are there for their client, and now it creates. Take a read. That's at pharmacypodcast.com. PN Pulse section. What are your thoughts? Instagram, Bill Brown, PharmD, and he teaches, and he's known as the Runner Farm on Instagram. I'll share with you.
Is the MPJE, the NABP is creating a new form of the MPJE. There's 2 goals that number 1, they're trying to establish competent in pharmacy law in general, trying to establish some portability amongst pharmacists. Currently, pharmacists for one state to practice in, and pretty the UMPJE would propose is couple different states to potentially practice in. And the UMPJE would consist of 2 things. There's commonality amongst multiple different states, and also still some federal law. As NABP is rolling out this new product, expect many other states to jump on. You want to know which states have already adopted this new MPJE below. Is the MPJE about?
I love it. I love it. I love it. I want to thank you, Will, for sending that to me. If there is new short insert that you can develop now about our industry from trenches, just go to tag us in a post that you need. Put in hashtag TWIRx, TWIR, and we will feature our TWIRx news segment, because this is, so take control of this. You're able to push information out. You're able to, and it's coming from your well. Okay, so we love this. Absolutely love it. To the APhA in Los Angeles. This is week, the 27th through the 3rd meeting. This is like the super pharmacy industry, and an amazing time to come together. Work will be in booths, and all about so once again, if you're going to APhA, part of the show, please reach out to us, reach out to me. 2026, it's going to be, our press coverage is going to be, they're such an amazing partner, doing the most aggressive, creative marketing, aggressive in the generic space. Everyone else is doing podcasts, is doing as much that they're really putting support some of the content. YARAL Pharma, get to know them. They really take things super personally. So if you have the things that they dig down into, steroid, pain management, topical, non-steroid, please reach out to YARALPharma.com, pharma.com, and network will be at APhA. We're going to one, like I said, press booth. The show to be part of it. So, hey, I want to give a shout out to Casey, and he is one of the founders of Pharmacy Network. I think he's on their board of TWIRx Pharmacy Network. If you have time to read this in a journal, British Journal of Sports Medicine, a paper with the one and only Sean. I feel like he's ours because we had him on the shows before. We see him. We're very proud of what he's doing. Welsh as well, Dr. Welsh for starting, and Scott Chelson, he's of the sports. Robert Nichols, obviously the godfather pharmacy, but read up on this again and just let them know if you have any interest. Give them a word of this published. Badass to see that. Hey, okay. Artificial, obviously everything's changing very quickly. Does it bother you that this is basically getting as quickly all of our lives, and we are starting using AI in many of we didn't have so much organization, so much from Pharmacy Times, AI transform pharmacy enhancing workflow, where this is where AI's wrap cardiovascular pharmacy tools. You're doing workflow, decision making, is to manage larger patient population. Comes you're flagging therapeutic regulation and checkup and PN schemes where they're payment, the positioning pharmacists to play a role in value-based management. I'm excited for pharmacists that are going to be digging into using to make you team led by. That's it, by the way. The AI is not taking over. Making your brain bionic. You have bionic brains now. AI at your fingertips, but it ultimately always comes down to the it's your use AI wisely. We have the pharmacies accelerating in Pennsylvania, Township is having a major expansion, 150 employees of square feet in this organization, this new location. Be that plug in to telehealth, and there's a consumer that is growing for cost plus drugs. Cost plus drugs is done in breaking old on the old payment systems of opportunity, and it transparency. They want access. They want to understand things. You have to make things that seem, and you have to. I'm not going to say. That's what I'm getting at. You're to a level that they can realize what's missing in pharmacy, the churn with big, huge chains and the money. And it wasn't the patient time to really talk with the pharmacist, how a pharmacist be able to help. The news on Alzheimer's disease journal and treatment research, which is clinical results for and the new kidney cancer guidelines, the protocols and patient care strategies. And this is because, once again, the speciality of specialty or pharmacists, and the board that sort of in the realm of your career, your credentials, and you become the alphabet soup after your name, specialty in pediatrics or disease or something. I don't know, but I think we need, because I think we need to suck up. We're going to see spilling out of into sitting at desk, either at their home or at the office, with access to large amounts of information and complete interaction, either by the state or state lines, depending on what NA. But therein lies what are years from now, you're going to see. We'll see how close I am. Percent of the pharmacists that were will be gone. They will know. And the realm of disease state understanding and knowledge, clinical trial access, pharmacogenomics. Watch, you pharmacists are going to the razor sharp play specific field, and you need that. So if you want to stake your very specific, even on the side as a side, continue to be obsessed with it. Start tracking it. But if it's has a future, and pharmaceutical companies are going to pharmacist and pharmacist consulting group and to their specific medication application and treatment and everything. So that's pretty exciting. that Alzheimer's and mental health for pharmacists to lead in treatment and to the research companies. Is something that I'm worried about, and this comes from the and it says at the policy level, growing around the future of a pricing program. We need 340B programs. I get so tired of this part of our profession, but the people, the green that was pulled, the program was designed to do, and giving access government funding to people that, like, come on. And now it's been abused. Continue to go through, and if not complete, the warnings to the that restrict or exit the program. It could higher medications for vulnerable patient populations. Good news. And I it's just disappointed. Program that we need getting that organizations, when they start auditing things, government funding, especially if the goes once again in coverage for senators and state representatives states, as long as that goes towards health care, then what could come of it. But watch for this election cycle and how that can impact a federally funded program, especially, and surely uncovering in California with hospice. Like, it just makes my stomach sick, because people could we be helping if there wasn't? It's billions and billions. It's very frustrating where that money, where we need it to go, especially with people that can't. There's always the talk of how you're running societies. Capitalism. I think the blueprint for and what the United States could do is if get some damn libertarian White House. That's what we need. But no, if we an opportunity to run health, then the rest of the different thing, because capitalism is the absolute best model. And socialism, and they've been disproved for the shown that it can't sustain a prosperous society. Right now is not working in healthcare. How do we carve out the entire health and have auditing, constant auditing? So you're just everything that gets funded, especially healthcare, for God's sake, the crap out of it month after month after month, keeping it clean so that we get them up. You think of the billions of dollars that we don't have for using because of the shutdown the country. And anyway, I just love Mary Cusick. Mary, look her up on LinkedIn, Mary Cusick, EK. founder of Prism, which is that system that focuses building your contraception business. We have a company called Ovariate. I love that name. Around several times, but those that we want funding to, because software in organization anywhere, cloud-based, to turn around a contraception management with a way to make money at it, private pay or and I buy SureScripts, for goodness sakes. That system's ready. If you're an independent community pharmacist, if you're a if you're running around the community as a consultant pharmacist, Mary Cusick, look up Prism, ovary, like an ovary it. We're going to be at the APhA. Very excited about the opportunity to see so much. It's the last APhA. We're so proud to be partnered with YARAL Pharma. We're going to be in our press booth, which will be 6. Once again, that's the YARAL Pharma booth. And then we're going to Pharmacy Profit Summit. Business creation. I should wrap. In a good way. It's a good. Hey, let's load up. It up. They, it's a fast team digging in for independent community pharmacists or what they're going through and starting to build things, a tremendous amount of freedom, rely solely on insurance organizations to being able to do things for your community that they want anyway. They're spending money in holistic medicine with no guidance, yoga therapists, information, and what better person is than a specialist, once again, like Dr. Buskov, Podcast Network, Marina Buskov, and podcast is exactly what she's proven. You could become the community, start with your county, introduce Health and Human Services, holistic pharmacy. It's up to you what you could dig down into that, but if you reach out to Marina Buskov or go look her up on the Holistic Pharmacy podcast or send me a message. Excited about what's happening. We are the Clearway Health for really excited about the insights that they're going to. That's why I get excited about working with. I mean, the sponsorship is wonderful. It's go to these big, huge, expensive, but their insight in our pharmacist and specialty and AI discussions, but that 2026 in Vegas is talking about technology, the tech, but the processes, specialty pharmacy. We're going to be talking about women's. We're going to be talking about artificial on specialty pharmacy. in this and you're not even going to Assembia and you want a co-producer of a segment, come to work out. We have sponsored consultant agreements that we get your stuff published. 1,000 listeners every month. Their pharmacy industry in the entire profession, because of the collective, because of your voices, your information, and we're building, and we're going to be moving much deeper. What I've been talking about, if you've read any of the LinkedIn about evidence-based podcasting and what that means, credentialing, passed through audio, access to that you have referenced in your podcast episode, to the published information that has been pure, but better and more important, getting updated. So imagine listening to a podcast that was published 1st of 2026. June 1st of 2020. There was a complete update done not only to the but also the audience, but to the listener. They have no idea. That is evidence-based podcasting. There's a whole universe together. If you want to get involved in this, we're looking at pharmacists who love the side hustle, developing information. And first, if you want to get your paper, put a podcast behind it, drive your insights through not just the ones on our network, people reading your information. You have to market your research information. There are beautiful posters at the conferences like NASP or NCP and ASCP, and you read these wonderful patient research that went into it. It's done. Like, you have to market that. Do all that research and all that plan and blah, 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 and changes and things that you needed to go back, and peer reviewer system, and good. You get that out there, then that information with you. We're ready to get and collaboration on your information. It's all about. It's our parent company, your business development interconnection public conference attending speakers, and yeah, it's got to do it right. So 43 different themes of podcasts right now. And it's all for you. It's dumping insights in a platform that you can listen to it all. And you want to dig into certified pharmacy technicians, and do Pharmacy 50 Award winner Elaine Simafior, and Elaine Ramos is a certified the Pharmacy 50 Award because of her influence on other and really growing the specialty for our pharmacy technicians. Extremely. So a shout out to Dr. Daniel Plummer. RX is out. If you want to really dental health impacts pregnancy health. Listen into that. Interesting. Also, a shout to Smith. She's the host of the podcast, and she talk about psychiatry, the cross section of the cross genomics and psychiatry and mental health. I think it's also really excited that Dr. Arshad on that episode. We are with Seba, her insights, and she gathers. She's a podcaster too, so if you haven't, go. It's Seba, S-A-B, A-R-S-H-A, Seba Arshad. Tell her you the Pharmacy Podcast Network. Marie, she has an episode out, the Holistic Pharmacy Podcast, with oxygen therapy and what that means, nations of other things that tie into interesting episode. We want to know what's going on in the great state. We covered the Pennsylvania annual meeting. It was wonderful. It was an amazing time together. We built a and much information coming out of Pennsylvania is done with the Pharmacy Care Network, the Pennsylvania Pharmacy, and the insights that Biden and Darren Mesh and Dr. Matt, these guys, Todd Laser, John Labs, Jennifer Earl episode. It talks about, not obviously Pennsylvania, but has some kind of connection parts of the country and pharmacy in general. Full collection of experts and know who's out there in your industry and network with them. Do it through this podcast. People up and say, hey, on the press coverage of the PPA or another podcast, but that's the work to educate for your own career. Reach out. Special 3-part series out there, and we'll even give you some money to build that out. All right, so going on, but we need more interaction. I know who's going to. I want to know who is Profit Summit in. I want to know who's going to the APhA, going to any of those conferences. Okay, Los Angeles. Pharmacy Profit Summit, Dallas. Sembia, Vegas. Pick your place. If I had places for vacation, for Los Angeles, or Pittsburgh, you know what I mean? No, not in the summer. And go to Dallas or Vegas, I don't know, in Los Angeles. So maybe I know they have beaches, and I do like beaches. I am Boston this week. We had zero internet. We're a publishing company. We live in a connection of the internet. Isn't that crazy? There's businesses out there built solely on wild. But we had power storms. There were even some tornadoes out in Pennsylvania this week in pharmacy. Monday, Tuesday, caused a lot of problems. That out this morning. So back on Musk and Starlink, because they're freaking amazing. They're always, this is all driven through AI. I can't remember what other engine, because of it being Elon Musk. They push issues up, and then as soon as something gets escalated, an actual person gets. It's a really cool use, but I feel like you're kind of all on your own. Mr. Gen Xer over here. Feel on your own, but then we got our brand new satellite system that got weather and wasn't working. Gen 2, so we upgraded to the Gen, and the direct, it felt like Apple, you know, packaging from Apple and how everything's freaking so cool. And I put it up on, had an issue with the peak right into the roof, but sealing it off and the connectivity, I think I was measuring 200 megabits, 300 maybe. It was fast, so very impressed. Yeah, it's going to be this week in pharmacy. I am to be part of this organization, or this. I want you to think about how could you work with us. You grow your career, connect you to the right people. Think about, come up with. This was Todd Uri with